Hi, Natasha.
Hey, Paul, how you doing today?
I'm good. So this is Paul Palmer
Natasha Todorovic-Cowan.
and
And
today
you
we're
got,
going to be talking about training. Why your training, there we go, why your training is failing and how to fix it. And it's not just about training, it's about coaching, it's about consulting. It's about really why doesn't it work? Why is sometimes it really effective and then another time it doesn't work at all? And I see this all the time in the pharmaceutical industry because some people think, well, if they've read the SOP, they should be able to do it. And then you think, well, maybe that's not how they learn. Maybe they're a kinesthetic learner. Maybe they learn by the audiology. Maybe they learn by visualization. And a whole 10 paragraphs of words or 3 pages of block text really doesn't enthrall them at all.
well, I have been doing training for coming on 3 decades. And there are a few different ways of doing training. Some people are just skilled at delivering the content in front of the room or helping with some skills and teaching at people those skills. But what I've found, and there's been research to validate this, that within 30 days of a training program, people forget 90 to 95% of what they learned. So training should never be a standalone unless it's something that one can actually train in a day or a half a day or 3 days. And what I found in the training market is far too many organizations are asking for short trainings. Give it to me today, give it to me in a few hours. And what trainers will do is try to do that. But the shorter some things are, the more higher level it is. And they know the organization isn't going to get the benefit. The client keeps insisting.
Yeah.
And a lot of trainers want to do the work. They figure that'll help build the relationship. And they can't say no to the client, or they can't say to the client, it won't work. Or they do say to the client, this isn't going to work. And the client's like, well, that's how we want it. That's what we've got budgeted.
That's what we're willing to pay for, I think, is a lot of the time. I recently did, well, I've done quite a lot of training in good manufacturing practices. And I was one of the one that comes to mind from a long time ago was an hour. It was an hour's refresher for the team. And I thought, this is really just ticking a box because the regulators expect it. And then the one I did recently, same topic, good manufacturing practices, was 2 days. 2 days, 8 hours a day.
Mm-hmm.
And it's the same topic.
Yeah, there are some programs, skills like public speaking. I trained that, some 30 years ago. And we found that training it in 2 12-hour days was much more effective than doing it in 3 8-hour days.
Oh, really?
Yes. So you have to understand what it is you are training and what the delivery mechanism is and how people embrace it. And we had just a monumental leap in those particular skills, but that was skills based. So you have to understand the topic and what the end result is. And a lot of organizations tell the trainer, this is what we want. The trainers assume that's what they want. They don't know how to do a good analysis of the situation. So they'll deliver what the client asked for, then it's not going to work. And then the client's going to say, well, they weren't a great trainer. They were fine as a trainer. They did what you asked. You didn't analyze it well. So what we always do is we insist on an analysis first to figure out the problem so that we can make a recommendation. Is it coaching? Is it training? Is it some more analysis? What is it we need to do here? And
That's interesting because I always go and do an audit first, see what's happening, work out where the problems are, see where the gaps are. Actually, I would say not always, because the last one was based on what the regulatory expectation was. But I still did several discussions with the guy that was asking me to do the training to find out what the content needed to be and how to approach it. So I suppose I did do the analysis. I just couldn't be on site to do the audit, which I would normally do because everybody was at home anyway because of the pandemic.
Well, and the other piece where you started with, just give them a manual, they'll figure it out. They're going to understand the words, right? Another piece of training, which is facilitative, which goes far beyond just knowing the content of something. And that means what you're doing is you're trying to understand how the person understands concepts, what that means in terms of behavior and output, and marrying them to these concepts in the more sophisticated way they need to understand them. So you have to understand it really well. You have to understand how people learn. You have to understand how people absorb things. You have to understand the material and the end results and how to get people there as rapidly as possible. And sometimes that requires adding a coach to the process. And sometimes it means taking a full spectrum approach, which means not only the consulting piece, the training piece, and the coaching pieces need to be involved to get that result.
Yeah. I also think you need to consider the variability between the people as well that are involved, because different people will respond better to different parts of that approach. So I'm always better when it comes to the practical side of things. I'll always take it on board better by doing it, even if I've got the SOP there in front of me and I'm doing the job side by side. I know that for me always goes in better than just reading the SOP. And what I find is a lot of people want me to read 5, 10, 15 SOPs in one go. And I think, well, I will do because you pay me to do it, but it's not going to go in and I'm not going to be able to use it afterwards. And when you do want me to do the job, I'm going to get the SOP out anyway.
Do we have time? We might not have time. I had a little drawing I wanted to share, but maybe we could do that on the next one, because I think it's actually useful to understand what these different service providers do to be able to understand when a service provider, such as a trainer, a consultant, or a coach, are talking to you about how they can help get an outcome.
And you mean about how the questioning techniques work for maybe you just need to share it.
Yeah, no, what I mean is what kind of work they actually do. And I think that organizations don't actually understand where trainers should be working, where consultants should be working, where coaches should be working, because it all kind of merges into one amorphous glom of something.
Let's talk about that next time then.
All right, let's do that, Paul.
Yeah, that's it for today then. It's Paul Palmer and
Natasha Todorovic-Cowan signing out. Great to be with you, Paul.
See you again soon.